Thank you for coming back for the second session, guys. And I'd like to introduce to Dr. Naina Patel.
Hi, everyone.
Yep. I've got your. Do you want to just give it a little bit of a background?
Yep. So my background's in qualitative research in type 1 and type 2 diabetes. I worked with Professor Kunti at the Leicester Diabetes Centre, University of Leicester, for about 11 years. Helped to set up the Centre for Ethnic Health and had the opportunity. I mean, my main area of research was with diverse ethnic communities. And it was about, for example, evaluating structured diabetes education sessions, understanding and addressing why people were reluctant to commence insulin therapy when they needed it. And so that involved producing resources, training healthcare professionals, particularly to deal with low health literacy and language literacy differences. And yeah, so it was very full on and very rewarding because there were a lot of directly translational research projects that I was involved in. But I had the opportunity to go and study for a PhD. I did it the other way around. I didn't start the PhD before I commenced my research. I went afterwards when the kids were older. So it was in dementia, which was completely different. But what wasn't different was the fact that I was going to work and conduct my research in dementia with diverse ethnic communities. So that's me. And then my passion and commitment has always been working and involving patients in research. So natural fit for a job was within the research design service as the patient and public involvement lead. What I do there is help researchers as well as companies that are applying for I4I NIHR funding to work with them and support them and advise them on how they can embed patient and public involvement. And it's quite timely, we were talking about that before. And if you're applying for NIHR funding, National Institute for Health Research funding, that is a requirement. PPI has to be evidenced as embedded within your product development or device development, whatever, innovative product you're developing, it has to be there. So who are the patients and the public? But before I start that, let's just clarify what we mean by patient and public involvement. It's research that is carried out with and by patients and the public rather than to them or for them. So that is the NIHR definition, and it's quite clear. So there's no expectations that the members of the public know about a specific disease in detail from a clinical point of view, but they do have lived experience of it. And that's what they bring to the table. And that's what you can benefit from. So who are the patients and the public? So potential patients are potential patients, existing patients, they're carers, people who use social care services as well as service users. And they could be specific communities. We talked about advocate groups earlier on in the presentation. And they could be from organisations, charities that represent people who use services and support groups as well. So they could be people with lived experience of one or more conditions, whether they're current patients or not. And one of the things that I still see when I'm reviewing applications for PPI is that researchers often confuse healthcare professionals and other stakeholders like care home staff and include them in the patient and public group. They're not part of that group, but it's very important to have the wider stakeholder engagement within the development of your research. And that could be potential commissioners as well as users of the service at a local, national level, depending on what your product is about. Next. So, we did talk about this earlier in Lucy's presentation in terms of EDI. Again, the NIHR, if you're applying to them, are committed to embedding equality, diversity and inclusion across its own research systems and culture. So what does that mean for you if you're applying and completing a research application form? But before I answer that, why are they doing that? And that is because they want to foster an inclusive environment and engage the talents and the energy of diverse people in all areas of their work, and improve the relevance and the quality of the work, of the research. Now, this is where it's absolutely crucial, because you will need to make sure that you do have a clear EDI policy. Now, the Centre for Ethnic Health have an equality impact assessment, don't they? I won't talk about it. I'll let you do it. But there are organisations out there that can help you with that. But what happens if companies and researchers don't embed EDI? Well, I mean, those headlines actually show you some of the kind of discriminatory outcomes, particularly in AI, or in maternal death. I think black women are 4 to 5 times more likely to die post-childbirth or during childbirth than white British women. So there are unequal outcomes. And what we can do is, as a research team, is to ensure that if you are producing a device, for example, that it can actually practically be useful to and relevant and work with darker skin. So some of us may have heard the news about the oxygen meters not reading properly through dark skins. But it was just only last week we had a researcher who has to use this one particular measure, this device, for research, but it doesn't actually work on black and Asian skins. So what do you think is going to happen? The findings, the results of that research are not going to be applicable across the board. It's only going to be there for a select few. And we've also supported people that are developing AI projects. And I won't go into too much detail, but we had the opportunity to work with the researchers to say, we know about the discrimination in the programs that's inherent. So can you make sure that you work with your diverse group of public contributors in the coding process? Now you might think, oh, that's really quite complicated. We're not asking the public contributors to actually do the coding because they're not qualified, but what they do is sit alongside the people who are coding to highlight some issues that the coders might not have thought about. And this is what happens, is that bias that can happen when the relevant people around the table are not present. So it is about making sure that you have an inclusive study design. So what are we saying? The kind of usual approach people think about is, oh, does that mean I need to have a black person or an Asian person and somebody who has a disability around the table? Don't look at it that way. All of us have intersecting personal characteristics. For example, I'm an Asian woman of a certain age. So there you go. I'm Asian and I'm a woman and I'm a certain age and probably of a certain social class. So what you're aiming for is that diversity of perspectives and lived experience. Obviously, it's got to be people that are going to be affected by the product, that can benefit from that product. And it is important to ensure that you do your best to do that. And again, a lot of our researchers, we do refer them to the Centre for Ethnic Health for support. They can also come to me and I help with the contacts that I have in various ethnic communities and also the charities that we work with and support as well. So, you're not out on your own if you're struggling with this. There are organisations there to help you. So, yeah, and I mean, one of the things that I learnt through my research career was that a lot of the times people focus on, some ethnic minority groups have strong health beliefs about something, about not managing their diabetes, and it prevents them cultural beliefs prevent them managing their diabetes effectively. Actually, what we found, it was to do with low health literacy. So when you're working with people on your products, on your AI digital devices or whatever, it is important to cater for diverse health literacy and literacy in general. Next slide, please. One of the things that puzzles researchers, some researchers, particularly early career researchers, as well as members of the public, is where is the PPI? What happens? Where am I within the research project? Or is PPI payment protection insurance? Is that what you're trying to sell me? It's a weird concept to get your head around. But what's even weirder is, where do you position your public contributors? And so this slide is a more sophisticated version of what I and my research colleagues, developed at the Leicester Diabetes Centre. We were working with adult learners from an organisation that worked primarily with South Asian communities. And we were asking them to become public contributors in a research project, but they could not understand the difference between research participation and public and PPI. So this is what we came up with, is to say, this is where you need to be. On the left-hand side, working as a team with the researchers, and to shape what's going on the right-hand side. And this helps early career researchers to understand as well. So you don't ask the people that are working with you then to participate in the research. You're recruiting different people for research participation in whatever you're developing. So this is the TRAM toolkit that would help you work out how your translational research project and the innovation pathway that you're likely to take. So this was developed by Roy Harris, my colleague, who's the advisor for translational research. And if you were to access our service, which I forgot to mention is completely free, and it's funded by the NIHR, Roy works with companies right from the early idea right to the implementation, and he helps with impact plans all throughout. And what I do, and when I get involved, is to support Roy with patient and public involvement, because we see a lot of companies that come in and are basically clueless about that and how to do it. So I work with them and support them right from the beginning, right to the end, to the point of submission. So you can access the TRAM toolkit on our East Midlands Research Design website. It's under the resources tab. There's also an introductory video. And if you want to access advice and support from Roy or with myself, please register with the service. And as I said, it's completely free. We're there to help you. So can we go on to the next slide? Yeah, all of it actually, yeah. So this is part of the pathway. Often people come in and they have their own ideas, and that's ideal. It doesn't have to be inspired completely by a patient directly, but what we do want you to do is, when you're planning your research, besides addressing all the kinds of other issues that you would do under the research planning, you also plan for your patient and public involvement, and within your project planning as well, PPI is right up there along with EDI. And actually you can also involve your patients and the public, depending on who you're involving, in some of the output and the impact plans as well. So it's got to be integrated throughout that pathway. In terms of the ideas, what we say to companies that come to us, maybe some, like the James Lind Alliance, may have identified a need. So in your application forms, look at James Lind Alliance, see if the priority that you're addressing has actually been identified, or how has it been identified? Has a clinician identified it and you've been supporting them? It's important to actually show that there's a clinical need, there's a patient need, or that it's been identified by patients through the James Lind Alliance. So if you're interested to see how projects have actually worked and been funded by the I4I NIHR funding stream, there was an evaluation undertaken back in 2015 by RAND Europe, a charity, a non-profit organisation. And what it aimed to do was to provide you with tangible examples from a diverse range of real-life projects about the factors that influence the progress and the performance of the I4I funded projects. And as you can see, the report was written using a variety of data collection methods. But in particular, there's an aspect of the report which focuses on the contribution of patient and public involvement. And I'm just going to read out some of the quotes that actually brings to life as to why patient-public involvement is important. So one of the research team talks about how the team involved patient representative groups in the proposal development process, which helped to include an end user perspective in the design considerations. And early consultation with patients helped the project team better understand patient needs and how they relate to product design and function aspects across different areas of application as well as patient segments. PPI created the opportunity to collect feedback on product design and testing throughout the project. Spending substantial amounts of time with patients helped to discover what the main issues were that they found or thought were important, and helped the project team explore a range of prototypes. And finally, in hindsight, and this is what we actually do hear quite a lot when researchers come to us fairly late on in the process, and then they start PPI, and literally you could see, oh, wow, the light bulb go off, because it does make a difference, a huge difference. Here it says that in hindsight, the team members noted it would have been good to have worked with even more patients at the start of the project to get a more objective understanding of the type of device that would work for different types of patients. So for me, and we stress this throughout in any of these seminars or talks that we do, is start early with PPI. You need to, as soon as you have a fairly good idea of where you're going, what your idea is, or even if it's even better if it's not fully developed, get patients involved. Get the end users involved right at the beginning. And if you want funding from the NIHR, you literally have no choice. You need to do that and need to evidence it. And you're probably thinking, how do I fund this? How do I fund the initial consultation? Well, if you register with us, we have a small pot of funding. Unfortunately, we close it on the 5th of May this week. But normally what we do for I4I funded projects alongside others is provide £300 to undertake that initial consultation, to listen to ideas that companies have about their products with patients. And the researchers go away and they show how they've changed their product design or the processes or the outcomes that they're measuring. But within your project budget allocation, your application, you will be asked to see how much PPI funding you've integrated in your application form. And again, we're here to help you with that. So even though our little small pot of funding has closed for the time being, the advice is still there, and right until September, because our organisation's contract is up for deliberation at the moment by the NIHR. So we won't know for a couple of months whether we have got funding or not. So, like to take any questions?
Are there any questions or comment from the group?
This was a short one. I went to an event the other day and they weren't saying EDI, they say EEDI because they want to talk more about equity.
Yeah.
And that, you know, it's not always about a level playing ground. It's about actually people of different ethnic backgrounds and social economic backgrounds actually need more visibility, more support, more help. I don't know what your thoughts were on that.
So on our RDS website, we've also got a toolkit, which is an EDI toolkit, which you can access. And we do talk about equity. You know, personally, equity is better for me. But we do look at the differences to say, how can we make something more equitable and equal in terms of opportunity? So the research system, the process by which you design your research needs to take into account the fact that whatever you're doing needs to be equitable for whoever you're, you know, it's not just about tinkering around the edges. It's about fundamental changes that you need to make. Yeah.
And the other thing I'd point was to show that, you know, with the projects that you've seen and the research projects that are doing amazing work and are really pushing the boundaries and breaking down barriers and boundaries, there's a real emphasis now on documentation of this and delivering that research, not just from a ref impact point of view, but actually from a social value. Yeah. I don't know if you've seen any really creative ways that people are using communications and creative communications, disseminating that research content.
I see some examples on a national level, not in terms of translational research like this that we're talking about today, but I've seen quite a few different types of projects that look at employing artists in the consultation process, but also creative ways of disseminating research findings. And one of them, again, is on the Leicester Centre for Ethnic Health, which is a video that that was developed by myself and a colleague during COVID, engaging with patients from African Caribbean communities and South Asian communities as a message to researchers to say, how do you need to behave with us and work with us if you want us to take part in COVID research? Because the underrepresentation of different ethnic minority groups in COVID research was appalling. And Professor Kunti was really trying his desperately hard to change that. And so one of the ways that we thought about that was through video and hearing from communities directly. So it wasn't filtered. So the script in that video is actually from the discussions. So yeah, there are different ways in which one can be innovative. Unfortunately, we don't see it as much as we'd like to, because I think funding is one of the issues. Because post-research, when it ends, you need to have funds to be able to do that.
We try and encourage the research projects that we work on in our teams to make sure that they've allowed that budget at the beginning of the funding project. Yeah. It often gets left, but we actually advise for 15% to be signposted towards communications, which isn't just all content at the end. It's actually through documentation through the process, having a really user-generated website, giving access and the tools to the research teams to be able to document the process from a video and audio point of view. So yeah, I do agree that the funding's a problem, but we should be thinking more about communications right at the beginning.
Yeah, And if we tend to think it's like there's just one way. And I think if the key message here is there are several ways, there are several audiences we need to tailor our communication methods. And in terms of evaluating PPI, patient public involvement, there are two, I would say toolkits, but there are two frameworks that you can use. One's called the GRIP2 and the other one's the PF. Yeah, so.
Lucy?
Lovely presentation. So we sit on various project review groups. We sit on Leicester Innovation Project Review Group. We're working the circle of knowing what's there and who does what. So to us it probably feels quite okay. I suppose my question is, how many companies come to you having kind of worked out that the RDS can do this fantastic thing for them and help them? How are they coming? Are they coming off their own bat, or are they coming through these kind of forums? And is there other things that we should be doing to try and increase that traffic?
It's a good question because they come to Roy directly through maybe webinars, and also Roy's been around for quite a while and he's well known, so I think there's a lot of it is word of mouth. But you know, there might be different ways in which we can encourage even greater footfall, you know.
Super. I've got, yeah.
No, thank you. My question is, Naina, it's the public and the patients that you have. Say a company has got a device that they want to test out, and it's a device test, like a user test rather than a medical device as such. So they come to you and say, we want to test this out, and can you have a cohort of patients and public? Is that how it works?
Well, it's if they're applying for NIHR funding for it. So if they're doing that as part of a research and an evaluation, then yes, they can come to Roy. And then I work and support Roy with the PPI, and we look at who needs to be round the table, and we would either direct them to the Centre for Ethnic Health, or what I could do is use contacts, or there could be, you know, charities that I know that could provide that support, and ask the researcher to. I do a lot of signposting, but then I have my own contacts. And I find that WhatsApp really works well. So I have researchers that come to me, not just for this, but a recent one was, it was one of the research projects. And the researcher was really struggling. So I said, look, put it in a little flyer, put the university logo in, email, and then send it to me. And then I WhatsApp it to my community contact, who then in turn WhatsApp it to their service users and their membership. And sometimes it works. I wouldn't say it works every single time because it depends on what it's about. But yeah.
So specifically, they're looking at applying for the NIHR grant. So that's where PPI would fit in.
Yeah.
And would that be counted, go forward thinking, if they want to introduce this product into the NHS, would that count as a trial? Because it's not random, the patients and the public, is it? Because you're actually asking people that you know, I'm guessing. So when you go to NHS, they want to see trials being done, etc., even if it is a device.
Oh no,
so
right.
It wouldn't be counting to what you.
No,
they wouldn't accept that as a
they're not. They're not research participants trying a product. They're actually, whatever that device is, it may work, but the design of it, the usability, they would be there working with the company to actually look at it.
And the demographics of it.
Yeah, not only the demographics, but what is this device? How does it work? What's the rationale? What settings are you likely to use them in? There could be issues with using it in this setting because I know, rather like that example of the MRSA, the front end, things are different. So what the company may have conceptualized as working and operationalized their plans, might not actually be feasible. And the patients who are likely to benefit from that device often have quite surprising, innovative, creative suggestions. So they're there working with the company.
Thank you.
Yeah.
Federico?
Yes, just a quick question. Is about the your research services are also support the work of academics or just tailored for industry?
Oh, academics, across the board.
And also, for example, follow up for I was asked earlier about when you formulate a research question, early stage of your application or grant, for instance, and you want to engage with patient groups, is that something that you do as well? Like a quick example, like a brain tumor type of device or therapeutics, and you want to build something around it, which way to signpost to.
That's what I normally do, is to sit with yourself, have an hour's meeting, and then say, right, tell me a bit about your project. Well, first of all, once you're registered, we ask you to provide a little bit of background, and everything is confidential. We're bound by that, obviously. So you would give an idea of your project, and then you would be allocated a research advisor. So it would be one of my quantitative, qualitative colleagues. It could be a health economist, and you're allocated an advisor. And then that advisor would either ask me to come in to help support you to how to identify people, patients and the public, or sometimes we have something called the multidisciplinary advice panel meeting, where we have the quantitative advisors, qualitative health economists, and myself. And there's about 5 or 6 of us. And we just sit and work alongside you via Teams to think about your project. You're not supposed to use the word brainstorm anymore, but, you know, that's what I'm saying. That's what we will do.
Are you able to get some feedback from the actual patient population?
Not from the patient population. So then what I would do is to signpost you as to where you can go to get that feedback and how to do it.
From real people?
Yeah, from real people. Yeah, real people that are likely to use it. So I support you to do that.
Okay, okay.
Yeah.
So just coming back to Pretty's kind of comment round about what you were doing as trials or not. So for a company that really wants to get into the NHS, one of the reasons we've set up the innovation clinics is to work with the East Midlands Age Centre, because they're the innovation arm. So we'll look at that project, and I say it's not at a confidential level, and we do look at stuff early stage, but we've already seen an example would be, do you remember rainbow trays? Remember men's rainbow trays? So they were coloured trays that you could put in anaesthesia and various drugs, and it was shown to reduce kind of dosing errors in anaesthesia. Great, fantastic. The trays are quite expensive, and actually they weren't getting into the NHS. But actually we worked with some guys at Northampton through the HSN to then get enough evidence that says, actually, even though your procurement area over here doesn't actually feel the benefit on it, we've got some good health economics that says, well, you know, they're really helping on this side, and it looks like they're now starting to be implemented in different trusts, because that's the thing, each different trust has its own buying power. But if you work through the HSN, that will help. So if you've got a specific project, get them another time to me, because we've got a space left.
Okay. Thank you.
And there are lots of community groups, voluntary organisations, charities around that, you know, you can access directly. But what we do say is researchers need to engage ethically, so they don't already put upon organisations that are working on the front line. So we always say, think about resourcing. But I may be going into ashes, so I'm not going to. Yeah, we always talk about resourcing, and that doesn't mean just resourcing in terms of finance. I mean, there are times as a researcher when I used to consult patient participation groups or community organisations, I didn't have PPI money, so what I would do is talk to them about a proposal And a couple of groups said, right, we've done this, we've given you time. How are you going to deliver? How are you going to pay back the time and energy that we've given you? And so I'd say, right, okay, what do you want to know about? Invariably, it would be diabetes, obviously, because that was my field. But I remember asking the clinical staff to come in and deliver a diabetes education session and on insulin therapy. So, or it was on dementia later on. So there are various ways that you can reciprocate. It doesn't necessarily have to be money if there isn't that pot of funding in advance.